Hi everybody, it's Vicki Hobbs from Back to Basics Birthing. I just wanted to run through some tools and techniques with you, some information, and just get you thinking about what kind of birth you would like to have with your baby. So obviously preparation is really important. Having the knowledge about what to expect and also to expect the unexpected, and what sort of techniques can you learn to help you get back into feeling safe and calm, undisturbed. But more importantly, what sort of techniques can your partner help you with, so that if you do start to feel stressed or concerned or really anxious, how can they actually bring you back into feeling, happy and calm and more relaxed, so that you achieve that, that calm birth that you're obviously planning. So it's really important that you're sitting down together, you're working out, what are your wants and needs for your birth. That's really important. I want you to be an active participant in your labour and in your birth. So that means being active, getting up, moving around, your partner having the tools and techniques to actually work with your body physically, work with your mind, looking at your emotions. So again, I want you to really be focusing on your mind, your body, your emotions, and also the energy and the space around you. Providing you with information about books and resources. So I have such a huge range of books and podcasts and websites and evidence-based information that I can share with you. So, if you're stuck, you can always email me and I can give you, I can direct you to my website, or you can go to my website and have a look at my my blogs. There's some really good information there. And I also share a lot of information from, well-known birth people like, Hannah Darlin, who's a professor of midwifery at the University of Western Sydney, Dr. Sarah Buckley, Dr. Rachel Reed, Dr. Sarah Wickham, Michelle O'Donnell. So all of these people are researchers. All the information that they have are backed up by evidence, and that's what you should be looking for, is evidence-based information, and getting yourself prepared for your birth. Also looking at your choices. It's so important that you know what your choices are. If you don't know what your choices are, then you have no choice. You're basically just being told what to do. So you're unique. Every woman, every baby, every birth is unique to that baby. If you've birthed before, whatever birth you had previously may be completely different for this baby. So it's about understanding what your choices are. Also looking at, like I said before, your wants and needs. What do you want to get out of having this baby? And if that is just more about feeling calm, feeling safe, feeling like you're in control, or that people are respecting you, people are treating you with respect, then they're the things that, you need to make a plan about all of those things. Your partner needs to be on the same page. And then you obviously need to share that with your healthcare providers, your obstetrician or your midwife. If you've got a private midwife, your doula. So, obviously making time to think about what choices you have and how do you want this birth to go. And you need to use your brain. I'm saying all the time, you need to ask all the right questions to get all the answers you need to make an informed choice. If you don't ask questions, then you don't know what choices you have, and then you're not making an informed choice. Okay, you're just being told what to do, which means that you're not an active participant in your birth. And also looking at what your rights are. So I've written a really good blog called The Rights of Childbearing Women in Australia. And this gives you all the rights that you have as a childbearing woman. So pregnant women have the right to informed consent and refusal of doctor recommendations. And a lot of women don't realise that. A lot of women just think that they arrive at the hospital, they get into the birth suite, and then they're told what to do. Most women, getting onto the bed, that should be the very last place that you're on. So again, making sure that you're an active participant in your birth and bringing your baby out into the world in a really calm, positive way. Have a plan. So like I mentioned before, we want you to make sure that you are highlighting what are your wants and needs for your birth. How do you want to feel? You know, what sort of things do you want your partner to do? Massage, acupressure, relaxation techniques. What are those techniques? Do you even know what techniques that you could be looking at to help you feel calm and safe? Because that is the key. Okay, we need you to feel calm, to feel relaxed, to feel safe, so that your body is relaxed, your mind is mentally strong, and that you're really focusing on, you know, how to have this baby, you know, how to give birth. And that is so important, that you've got a plan, that you're sharing that plan with your partner, you're sharing that plan with your healthcare providers. You know, and also planning for unexpected things. So plans don't always go to plan. We know that. You know, sometimes when we're planning a holiday, we might be planning to go to one place, or we might be planning to go on a boat trip, and then we wake up that morning and it's pouring down with rain. So we have to change those plans. And birth is no different. Sometimes there's deviations to that pathway along that plan. So it's really important that you know, you do your research. Think about all the things that you may need to change. You may need to be induced. You know, if you've got a medical reason, you may need to be induced. You may need your labour to be sped up for some reason. Okay, so these are all the things that you need to think about, and you also need to plan for. And again, being in control, asking questions, making sure that you're aware and you understand what is going on and why something's being done, so that you, again, feel like you're part of that decision-making process. Looking at your breathing. So in my Back to Basics birthing class, I have the 3 breathing techniques, very similar to the Hypnobirthing Australia classes that I teach as well. So, but I use flow breathing, which is your relaxation breathing. So looking at how do you create that calmness within you? How do you create, you know, that ease and that relaxation through your body, so that your labor can progress? I then go into progress breathing. Your progress breathing is what you're doing during your contractions. Because if you're not breathing properly and you're not getting oxygen to those muscles, then it means that your labor can't progress. Okay, so that is a really important component of the whole breathing technique. And then we have birth breathing. So it's different again when you actually get to that pushing phase. So, you know, doing your preparation and attending independent childbirth education classes will really help you with your breathing techniques, with your relaxation techniques, and about owning your birth. Again, keep coming back to that, being an active participant in your birth. I really focus on the 5 senses. So that has always been my big thing. Even before I was doing Hypnobirthing Australia, I've always focused on the 5 senses. So we're looking at sight. What can you see? Okay, when you're looking around the room of your birth suite, how does it feel? You know, what can you see? Is there something there that really stands out and helps you to feel comfortable? What about having vision boards, posters, some things from home? Maybe if you've got other children, you know, photos up on the wall of your other children, so you actually feel like they're in the room with you. What about taste? Can you eat during labour and birth? And what sort of things should you be eating? What sort of things can your partner have for you? What things should your partner have for himself or herself? Hearing. You know, hearing is really important as well. And I really want to emphasize that during labor, your senses are heightened. Okay, so your sense of smell becomes more acute. Your sense of hearing becomes more acute. So even though, you know, someone might be talking to you and you're in that zone, you can still hear what they're saying. You might not be responding, but it's definitely important for you to recognize that you can still hear what is going on around you. Okay, and if you're hearing midwives talking, or your obstetrician talking, or people outside the corridor, you know, talking about you, then you're going to pick up on that. And you're also going to pick up on the energy around you as well. So, and when we're talking about smell, you know, conditioning yourself to a certain smell that triggers that relaxation, releasing those endorphins. Your endorphins are your pain relieving feel good hormones. Okay, and the more endorphins you have in your body flowing through you during that labor is going to actually help you during your birth. And touch, you know, as a remedial massage therapist who specializes in pregnancy massage, touch is such a key component for me. And when I talk to my clients about touch, I always talk about feelings. Okay, so that touch is also about feelings. Asking the mum, you know, how do you feel? What do you need? What do you want? Watching the mum, checking, you know, you'll see when her shoulders are really tight or if she's clenching her jaw. So those are the things that you know, as a partner, you should be able to recognize. But if you don't know, you don't know. And that's why it's so important to go to independent childbirth education classes, where we focus on all of those tools and techniques that are about the 5 senses, bringing you back into a state of calm. So like I was saying, touch and feelings. So bonding together, massage, you know, acupressure points, but just touching and feeling each other, connecting in, you know, dads and partners wrapping their arms around your belly and actually feeling in and connecting with your baby. That is so important for, you know, that whole bonding process. So as a couple, you know, I'm going to teach you different tools and techniques that you can work on together leading up to your labor and birth. So you have it down pat, you know, you have it already worked out what feels good, what doesn't, but also recognizing that what feels good during pregnancy may not feel good during labor and birth. Okay, so again, you need to be able to adapt and change. So, and it's, and in the moment thing, I say this all the time, you're always working in the moment. Okay, some tools and techniques are going to feel really, really good for a couple of hours, and then it's kind of like, nope, stop, I need something different. Okay, and that's okay. We look at the pelvis, okay, and this is about you understanding what the pelvis is, how does it work, what is its function during your labor and birth, and what you have to do during your pregnancy to ensure that your pelvis is in optimum condition, so that baby can get into optimum position, so that you can start looking at having a better birth. I particularly, again, because I'm a massage therapist, and I've also done the spinning babies workshops, and I've done the optimal maternal positioning workshops with Ginny Fang Davey. You know, have a look at the OMP information on the website. So optimal maternal positioning with Ginny Fang Davey. It is so important that you understand how your pelvis works. What are the ligaments involved? If those ligaments are shortened, what's going to happen to the pelvis? And how is that going to affect your baby's movement in the pelvis, rotating in the pelvis, those cardinal movements, getting out of the pelvis into the birth canal? If you don't understand that, then you're not going to know what to do if things start to slow down or baby's not in a good position while you're in labor. So important that you recognize and know what the pelvis is, what the ligaments are, and also the muscles involved. So the psoas muscles are so important, getting that baby into position. If those muscles are really tight, then it means that it's going to reduce the space that your baby has to get into the pelvis again, to rotate, to move out. Okay, so doing, again, independent childbirth education classes is a key component in identifying those areas where you need to, you need to do some work during your pregnancy, and working out what things are going to restrict your baby from getting into a good position. Give your baby room to move. And, that's the key message, all right? So we're looking at the bone structure, the pelvis. We're looking at the soft tissue, the ligaments, the muscles, Okay, so all the things that you need to work on to help your baby get into this beautiful position where it's an easier route out. You can do this. You know, it is really easy, but you don't know what you don't know, and you can only do what you're prepared to do. I also go through a number of different labour and birth positions. I also give you things like Rebozo, so that you can practice at home using the Rebozo with some really good tools and techniques to actually help relax the pelvic floor, to relax those joints, to relax those ligaments, and also to help the mum feel really calm and relaxed as well. And being active. You know, I'm not suggesting that you go out and you know, try and do these really amazing yoga moves. Look at this incredible woman. But it's about, you know, getting out and about, getting some fresh air, going for walks along the beach, you know, just being active and moving, uncrossing your legs. So again, when we go back to looking at, you know, the best position for your baby to be in, if you're crossing your legs, I want you to do that now. So just cross your legs over, okay? What do you feel? Do you feel that restriction and that pelvis and your legs actually closing everything in? That's not what we want. That's going to reduce the space that your baby has to move. So it's about opening everything up, okay? And you can do that. It is really easy. There's some really great techniques that I can show you. And your baby needs you to be ready. The two of you, not just mum, not just dad, the two of you need to be ready. The two of you need to be focused. You need to have a plan. You need to be prepared. You need to have that knowledge, and you need to own your birth. You need to have a voice, both of you, and you need to protect that birthing space, okay, and feel confident and strong in doing that. So with my Back to Basics birthing classes, I have quite a few options. So I have the online package that you can just download, you do it at your own pace. I have live online courses using Zoom. I have in-person, face-to-face courses, and I have private sessions as well. And you can do that either face-to-face or online. So lots of different choices, lots of different ways of becoming educated, and all you have to do is get in touch. So just email me, Vicki@vickyhobbs.com, or just go to my website, so backtobasicsbirthing.com.au, and there's a heap of information on there just for you. So I want you to really enjoy your birth. I want you to have the best time. I want you to love your pregnancy. I want you to really look forward to going into labor, knowing that you've got tools and techniques that will really help you to feel relaxed, feel calm, to bring you back into that state of calm if you've become tight and tense. And again, you know, we need your partner to know that. If you don't have a doula, or you know, you don't have an extra support person, it's really important that your partner knows what they can do to help you through your birth. So I look forward to speaking to you. I'm happy to have a chat if you need some help. Check out my website. I've got a great lot of resources on there on my blog page. And I just want you to feel like you're going to have a good birth.